Now I'd like to introduce to you our moderator for today's climate and health session, Lisa Carlson. A graduate of Emory School of Public Health, Lisa has spent more than 25 years working in public health and medicine. At Rollins, where she received her MPH, she's an affiliated instructor in the executive MPH program, and she also is the executive administrator of research programs and operations at the Emory School of Medicine. In this role, she works alongside the School of Medicine leaders to develop and implement key research initiatives. And among her many accomplishments are facilitating an annual fundraising growth in transplant research from 8.1 million to 29 million, and launching the operations of the largest sponsored award ever received at Emory, some 78 million. Lisa, I hope we can get you to work with Sophie. And if that's not sufficiently impressive, Lisa is this year's APHA president. I think there's only been 4 or 5 in the organization's history from our health education profession to lead the nation's largest public health organization. As you know, Lisa's a trailblazer, and her enthusiasm and energy are boundless, and I dare say even infectious. Given APHA's focus on climate and health, she's the perfect person to kick off this afternoon's plenary, Impact of a Changing Climate on Health and Populations. Lisa, thank you for joining us.
You bet. Thank you, Elaine. And that was a lovely introduction. Thank you so much. I live here in Atlanta, and I was very much looking forward to welcoming all of you to Atlanta. I have been telling Elaine how impressed I am at the speed and amazing way that Sophie got us together here online. So it's nice to virtually see so many of you with us here today. And I bring you greetings from APHA. APHA is very active in climate change work, and hopefully you're aware of some of that work. From my perspective, one of the most interesting things I think we've done, and one of the most important things I think we've done, is at last year's annual meeting, we passed an APHA policy on mental health and climate change. And so this is an issue that in my year as president of APHA, I'm going to be focusing on quite a bit, is mental health being essential to public health. I would argue that right now, in the times we're in, mental wellness is something we should all be paying great attention to while we are physically distant, making sure we remain emotionally and socially connected to those we're with. And so I thank you for being with us today in that regard. So welcome. So I'll be your moderator today. Before I introduce our first speaker, let me just let you know that at the end of the presentations, we will be taking questions from the attendees. For our virtual attendees, you can enter your questions in the chat box down at the bottom of your screen there. You can click on chat at any time during the presentation, and I'll read those questions aloud for the speaker's response after their presentations, and we'll answer as many questions as time will allow. So without further ado, let me take us to our first speaker, which will be Paul Schramm. Paul is a health scientist with the Centers for Disease Control and Prevention. Paul?
So again, my name is Paul Schramm. I'm the climate science team lead in the climate and health program at CDC. And I'm going to be going over climate change and human health today. So what I'm going to cover, I'm going to start with what are the health impacts of climate change? Why are we worried about it in public health? Why is CDC doing anything on this? I know it's been an issue that's gaining traction in public health, but I'm sure many of you might still be kind of unfamiliar with some of the impacts and some of the different things that are going on in the field of climate and health. So I'll cover that. I'll cover CDC's climate and health program, some of our actions, as well as actions of health departments with a couple of examples. And then finally, especially for this audience, I'll be going into various CDC communication tools and resources and different research on how to best communicate this issue. So starting with the health impacts of climate change, this is a colorful and busy graphic that starts in the center with the impacts of climate change and moves out from there with the environmental impacts that these cause. And then finally, that outer ring is potential health impacts from climate change. So just kind of going around the circle, you can see it's a wide variety of issues that pretty much impacts all areas of public health. Potential increases in air pollution can lead to asthma, cardiovascular disease, or at least exacerbation of those conditions. You can see how changes in vector ecology could impact things like Lyme disease, spread of ticks and mosquitoes in some area. Increasing allergens. We're working on a literature review right now on the impact of climate change on pollen. And there have been a number of studies that have shown a shift in the pollen season, as well as a change in where certain allergenic species can grow. So this, of course, has big impacts for respiratory health. There are water quality impacts, as well as foodborne, waterborne diseases, general environmental degradation that can lead to a number of different health impacts. And then, of course, heat, increasing heat waves in many parts of the country with direct impacts on health, as well as severe weather, which in some regions has been increasing and can lead to direct injuries and mental health impacts. So even with everything that's on this busy slide, it's not complete. So for example, you'll notice you don't see wildland fires on here. There are a lot more things that are impacted on climate change that can't even fit onto one slide and have a wide variety of health impacts. So this is a start, and this is what the public health field is working on. And as you can see, it's a challenge to communicate this. If you'd like to see a little bit more information about some of the health impacts of climate change other than just that one slide, our website is a good place to start, cdc.gov/climate and health. Or if you just Google climate and health, it's one of the first sites that comes up along with APHA site. But these government level assessments have a lot of good information about the health impacts of climate change, as well as a number of other sectors. So that document you see on the right came out in 2018. It's the 4th National Climate Assessment, which is an assessment that's required by Congress and comes out every 4 years. So we're currently in the process of setting up the 5th National Climate Assessment. So this report, which has a great website, very interactive, downloadable content, et cetera, it has both regional chapters if you want to see the impact of climate change in the region where you live, but there's also a whole chapter on health. Also, the document on the left, which came out in 2016, outlines the impacts of climate change on human health across a variety of sectors. For example, it's organized by climate impact. So there's a chapter on vector-borne disease. There's a chapter on air pollution. So if you're looking for more scientifically supported information on what the impacts already are and what they're projected to be in the future, these are great documents to start with. So that's the bad news, that we're seeing these impacts already. They impact all parts of public health, and they're projected to increase in the future. The good news is we have a program at CDC, and there are a number of health departments across the country working on this. So our program at CDC was funded by Congress starting in 2009. So we just celebrated our 10th anniversary. Our vision is that we are the national leader in empowering communities to protect human health from a changing climate. And an important part here is the empowering communities part. The impacts of climate change are very local. They depend on what's happening with the climate in that region. So for example, the impacts in Florida are going to be very different than the impacts in Oregon. So it really requires that on the ground work that takes that context into mind, and then that also looks at the local population. And in some of my upcoming slides, I'll show how we help health departments look at specifics of vulnerability and demographics in their jurisdiction. There are 3 strategies that we use to do this, and health departments use a number of these strategies as well. The first is building the evidence base. This is still a relatively new field. Of course, public health has known that weather and climate can impact health for quite some time. In fact, there was actually an article way back in 1923 in the American Journal of Public Health that noticed differences in vector-borne diseases in Chicago versus New Orleans, and postulated that it was due to the climate. So as far back as then, it was known that climate impacted health, that weather impacted health, and now we're seeing how climate change is continuing that. So that first strategy is really to build this evidence base, to be able to inform people on what the health impacts are, and not only that, but also what we can do about it. What steps can health department take? What adaptations and interventions actually work to protect health? So building the evidence base on that is critical. The next step is to expand capacity, to make sure that public health professionals around the country are prepared for climate change and have what they need in order to protect health. And then finally, tell the story, which is a really important strategy about communication. being able to share this information, tailored information to a variety of different audiences, and also collecting best practices and sharing and distributing those best practices so that we learn from what health departments are doing. So one of the main ways that we do this, especially the part about building capacity, is through cooperative agreements and grants out to health departments. So we started our Climate Ready States and Cities initiative way back in 2010. You can see on this map the original 10 jurisdictions, 8 states and 2 cities that were awarded through a competitive grant from CDC. And these states are working on climate adaptation. We were able to expand that with additional funding in 2012. So here you see all of the states and cities, which we still fund up to now. 16 different state health departments and 2 city health departments are working to implement a framework that I'll discuss next. But we didn't stop there. We also expanded in 2017, thanks to a small budget increase, to work with tribes and territories. These are populations that are particularly impacted by climate change. So we partnered with the National Indian Health Board, as well as the Association of State and Territorial Health Officials, to help provide technical assistance and funding to a number of tribes and territories. And this began in 2017. We then expanded one more time with mini grants through a variety of different partners, ranging from, again, National Indian Health Board to Council for State and Territorial Epidemiologists, and a few others, to provide mini grants out to additional tribes, a couple of states, cities, and counties. And these are all done through a competitive process. So we've expanded quite a bit. Not all of what you see on the screen right now is still funded. A few of them were smaller 1 to 3 year mini grants, but we've been able to expand actually up till now to more than 40 different jurisdictions that have received funding. And we actually are going to be announcing within the next month the latest round, which will add 3 tribes, a city, and another county. So this is, as I mentioned, the health impacts of climate change are really localized. So we've been very grateful that we've been able to provide funding and technical assistance to this many jurisdictions across different parts of the country. So you might ask, well, what are these jurisdictions doing? A big part of it is what we call the BRACE framework. That stands for Building Resilience Against Climate Effects. So we launched BRACE with those initially funded jurisdictions back in 2010. It's a 5-step process. It starts with step 1 on the left, which is anticipating climate impacts and assessing vulnerabilities. So this is where a jurisdiction looks at, okay, what has the climate been like historically in my jurisdiction? How is that changing already, and how is it projected to change? And for a larger jurisdiction, such as maybe the state of California, they might have to do this in regions. Or for example, in a city, you might have to even drill down to the neighborhood level to see what some of these impacts might be. And then assessing vulnerability. And this is taking a variety of different factors, demographic factors, localized climate impacts, what adaptation actions are already in place to help assess which specific areas and populations might be more at risk from different aspects of climate change. And this can vary from hazard to hazard. So you might have a population that, say, is very susceptible to sea level rise and the impacts that that has on health. And it might be a different area of a city or state that's more susceptible to, say, heat waves or vector-borne disease. With the information from this, jurisdictions then move into the second step, which is projecting disease burden. This is basically saying, we looked at what is happening with climate change and we looked at who's vulnerable. Now, what does that mean for the future of disease in our jurisdiction? And this can be very simple. In some cases, if there's not a lot of resources in a jurisdiction, they might just say, well, we've had heat waves, we've had deaths from those heat waves, we've had people going to the emergency room from those heat waves, and heat's projected to get worse. So we're projecting more morbidity and mortality from heat in the future, but it's just qualitative. That's fine. Some jurisdictions, that's what they can do with the available staff and resources. But what we also have is some jurisdictions who get very technical. So for example, the state of New York with our funding has projected future asthma rates. So they developed an exposure response relationship for the past, looking as air pollution changes, how does that impact asthmatics going to the emergency room? Then they looked at how temperature and sunlight impact that air pollution. And then they projected how that will change using climate models and projected the number of future asthma cases, visits to the ER in their state. So it can be very technical like that. And in some cases, that's very useful for projecting future cost estimates, as well as for policy implications. So there's a lot of different ways to do this. And again, it's going to depend on the capacity of the jurisdiction. From there, we move into step 3 of this framework, which is assessing public health interventions. So this is what we do about it. You know, we know that asthma is going to be an issue, or we know that heat or vector-borne disease is going to be an issue. What will work in our jurisdiction? So this can start with a literature review. It can start with looking at other interventions that have worked in similar cities or other states, and then deciding what's actually feasible to implement, which goes into step 4, developing and implementing the climate and health adaptation plan. So this is really putting into place steps 1, 2, and 3, taking all the information, saying, here's what we're going to do. We're going to open cooling centers, and we're going to target them to these neighborhoods. We're going to have an education campaign to limit exposure to ticks in summer camps. You know, there's a wide variety of things that can be done. And then finally, even though it's listed as step 5, it's really an iterative framework that step 5 has to be throughout the whole process, and that's evaluation. That's in order to improve what you're doing and make sure that you're actually having an impact on human health. So we really recommend that evaluation and monitoring is built in right from the start. So that's our BRACE framework. There's a lot more information, again, on this on our website. I also want to point out that it's adaptable. You know, I kind of described that a little bit when I was talking about step 2 and the different approaches between qualitative and quantitative that different jurisdictions might take. But really, there's a lot of different ways to adapt BRACE. Some places, it's not necessarily in the order that I mentioned. You know, there might be some pre-existing work that can feed into certain steps. What I have on the screen here is an example from one of the Climate Ready tribes that we partnered with through National Indian Health Board. This is the Swinomish Indian tribal community, which is in what is currently present-day Washington state. And they said, well, BRACE doesn't really work for our ideas of what is impacting health. So they looked at things like what are listed here in the middle, their ideas of resilience and self-determination, the natural resources that they have that really their health depends on, and they adapted the BRACE framework. So this is just one example of how local issues can be incorporated into the BRACE framework and can be adapted to really meet community needs. So I don't want to make it seem like all we do at CDC is just work with health departments. That's a huge part of what we do, and it really helps to get at that really local aspect of health impacts of climate change, but there's a lot of other things that we do. So I at least wanted to mention that we have a lot of internal epi research. These are some of the areas that we've been focusing on to really build that strategy we have of increasing the evidence base. So some areas we've been focusing on recently are heat, drought, flooding, aeroallergens, and wildfire. And this is for a number of different reasons, partially because these all have big impacts on human health, but also because they're what we've seen health departments are working on, and also where there are gaps in the field. So on our website, all of our recent publications are listed. So if you want more information on these, again, the National Climate Assessment is a great place to start, but for peer-reviewed articles on these different topics, you can see our webpage. We also have people working on climate health communication, climate health evaluation, and of course, coordinating across federal government. For example, there's a federal group on climate change and human health, and CDC serves as one of the co-chairs. I want to just briefly give a couple of examples of what grantees and health departments are doing around the country. I only have a couple, and then I'll point you to a few resources where you can read more about what they're doing. So I'll start with what San Francisco is doing for heat. This is one of our grantees in the Climate Ready States and Cities Initiative. And a lot of people don't think of heat as being an issue in San Francisco. You know, you think of the fog, you think of having to wear a jacket even in summer, but heat is becoming increasingly more of a problem. They've had more extreme temperature days, and a large proportion of residents do not have air conditioning or access to another source of cooling. So what they did was created a heat vulnerability index. This was the first one that the city had ever made or implemented, and they went down to the block level. So they actually collected information, for example, on how many trees were on a block or what the surface was like. Was it something that really absorbs a lot of heat, or was it a cooler block or a cooler neighborhood? So they used 21 different social and environmental vulnerability indices to be able to tell what the block by block vulnerability was to heat waves in their city. So this really has helped them, once they've implemented it, to inform all kinds of decisions. It helps with city planning efforts. It helps to decide where to place cooling centers, how to use transportation to get people to those cooling centers. So this is an example of really looking at that local vulnerability and using data so that resources can best be allocated. Another example from the Minnesota Department of Health was for air pollution, and this is a good example of collaboration. So at the state level, there's a lot of different collaboration on climate health issues. So what they were seeing, especially in their urban areas, was that air pollution was getting worse as the summer was getting hotter. So they developed air quality alert messages, basically a communications tool to help protect people from air pollution exposure. And this didn't just come out of the Department of Health. It was a multi-agency collaboration with their State Department of Transportation, as well as the Minnesota Pollution Control Agency. So this really led to consistent public health messaging that was coming out of non-health agencies, and the health department helped to coordinate that. So the end result of that was that it did engage new audiences. It was able to target groups that were especially sensitive to poor air quality, and they're currently monitoring and evaluating to see what impact this had. So those were just two really quick examples, but we have a number more examples that are documented, and you can see online in these adaptation in action documents that we did with APHA. So the first version came out in 2015, you'll see that on the left, and the version on the right came out in 2018, and these have basically success stories from different jurisdictions around the country, different health departments, and what they've been working on and how that's helped to protect health. So if you Google adaptation in action, these will come up, or you can also link to them from CDC's Climate and Health webpage or from APHA's webpage for their Center for Climate Health and Equity. Lastly, I want to focus on communicating climate and health. First, I'll give just a little bit of background on it and then talk about some resources and tools that CDC has for health communicators. So I'll start with Global Warming 6 Americas. This would be the point where if we were in person, I would say, who's heard of this? Raise your hand. This is kind of the cutting edge of climate change communication. So this comes from George Mason University Center for Climate Change Communication, as well as the Yale Program on Climate Change Communication. And these slides are courtesy of Dr. Ed Maibach. So they've done a lot of different surveys, interviews, and what they've seen is that when it comes to belief on climate change, Americans fall into these 6 broad categories. So it ranges from alarmed, so people who are saying, you know, climate change is a huge problem, we needed to be acting on this yesterday, to dismissive, which is people who don't believe it's an issue at all, think that it's overblown or not true. But what we're seeing is actually 76% of people fall within either the alarmed, concerned, or cautious group. So these are people who think climate change could be an issue and are willing to listen to different communications messages. I mean, what we've been seeing, because they've been doing these surveys for a number of years, they're seeing that over time, the people in these groups on the left are growing. Sorry about that. I don't know why the slide keeps advancing. So we're seeing fewer people in the disengaged category and more people towards the more concerned side, the more motivated side. So people, you know, this isn't maybe what you're used to hearing, you know, but people aren't really skeptical about this issue anymore. It's mainstream and people listen especially to messages about climate and health. So how do we take advantage of that when we're communicating with people? It's through simple, clear messages. So I know most people listening in are health communicators. You know this, that simple, clear messages are the way to go, but the studies are showing that's true as well for climate and health. So starting with something like climate change is harming our health here and now, and using examples from your specific city, state, et cetera. Then moving forward and saying that it can impact the health of anyone, but some face greater risk. So that's getting into vulnerable communities, but that it can impact anyone. That's an important message. And finally, that there's a lot of things that we're already doing and we can do more. So that's a little bit more of a positive message, showing some of the examples that I talked about, saying, you know, don't throw your hands up. The health department's working on this. There are other people working on this issue. So what Dr. Ed Maibach has found in his research is that repeating these simple, clear messages is really what gets to people and gets the message across on climate and health. So how have we done this at CDC? Well, there's our webpage. Again, I will point you to that if you haven't gone there before, but we have a wide variety of resources on climate and health. A lot of them are for public health professionals, but can also be used by their partners. So these are organized into guidance and trainings. So we have technical guidance, technical reports, et cetera, webinars, which are archived and captioned for future use, a variety of videos, and this is both videos aimed at the general public, just about the background on climate and health, as well as videos aimed at public health professionals. So for example, we have a new video series on evaluating climate and health interventions, and it walks health departments step by step how to evaluate an intervention. And then finally, data and tools. So an example of this is we work with CDC's National Environmental Public Health Tracking Network, which has publicly available online data on a variety of different environmental health issues. We worked with them to put a module specifically on climate change onto their online portal. So you can go on there and download or map or graphically display, for example, temperatures for your county, both in the past and into the future, or whether or not you're in a flood hazard zone, or the number of hospitals in your county that are in a flood hazard area. And then this can be paired with health data such as ER visits, vulnerable populations to heat, et cetera. So that's an example of some of the data work that we help to make available for the public and public health professionals. We also have quite a few different communications tools. So these are a few examples that are on our website of toolkits we have. So on the left, you see a climate and health social media toolkit. So this goes through how health professionals can use social media to get out different messages on climate and health, and it includes example tweets, things like that. And then on the right, a broader toolkit for communicating the effects of climate change and health, which includes things like PowerPoint slides, a modular slide deck that you can pick and choose from. You can adapt if you're giving a webinar or community presentation. We also have a number of additional videos that focus on communication, as well as a success story template. So if a jurisdiction wants to capture those best practices within their jurisdiction, they can use this and capture that information as a future communications tool. We had a whole webinar series specifically on climate change communication. And these, again, are all archived, and you can watch them on our website. You can see the 6 different topics that we had. These were held towards the middle of 2019, but again, ranging from climate and health social media best practices to public outreach and dissemination, and how you can do public meetings on climate and health. So if you're interested in that, please see these on our website. We also had a guide for cross-sectoral collaboration. You know, climate change work is inherently cross-sectoral. We try to make sure public health has a seat at the table, but a lot of times health departments, they're not doing this work on their own. They have to be working with other sectors. So last year we released this guidance document as well as a webinar that's archived that launched it and described how to use it for health departments to work with 10 different sectors on climate and health. These are the different sectors that are included. So you can see it ranges from agriculture and farming all the way down to zoning, land use, or water utilities. These are different sectors that health departments often have to work with in order to implement adaptations on climate and health, but they may not be sure how to do it or why those other sectors might even begin to engage in health. So this gives advice on that and different things you can use when you're working with these sectors. So the last thing I want to mention, everything that I've talked about so far is for public health professionals. We also have tools and resources for communities. So things like fact sheets, infographics, videos that are aimed at the general public. And these can all be used as communication tools. So if you're, again, working in public meetings, putting things on your website, deciding what to tweet or Facebook, these are all things that are aimed at the general public that you can use. So that's what I wanted to cover, and I will turn it back over to Lisa, and then we will have time for questions at the end. Thank you.
Thank you, Paul. Appreciate that. We do have folks who are typing their questions into the Q&A, which I appreciate. As soon as we get through both presentations, I will read those questions out to our presenters, and we'll make sure we get you answers. So if you have questions, keep putting them there in the Q&A box. And we'll turn now to Rebecca Rear, who is the Director of the Climate and Health Program for EcoAmerica. Rebecca?
Great, thank you so much. Give me a moment while I share my screen. Great. So first of all, I just want to say thank you so much to Sophie for hosting this plenary and the opportunity to talk about climate and health and what we can do about it. Thank you also for forging on with this meeting in the face of so much uncertainty. Many of us who work on climate and health are still feeling the urgency to act on climate change as the most pressing public health threat of our time and not lose hope or momentum, even in the face of this new pandemic to which we all must dedicate resources and empathy. I'm looking forward to not only just the subject matter report out from this conference, but also some tips from Sophie on how to run a virtual meeting, because I know many of the organizations like mine are looking to host virtual meetings in the coming weeks and months. Thank you to Paul and to Lisa for your remarks. You'll hear some important points that they both made reiterated in my presentation, and I'll have a deeper dive into action and advocacy, and in particular, why it's so important for health professionals to engage on climate solutions. So first, a little about us. As Lisa said, I'm Rebecca Rear, Director of the Climate for Health program at EcoAmerica. Climate for Health is a national initiative to build climate leadership and action across the health sector, advancing solutions that protect personal and community health. Climate for Health is a program of EcoAmerica, which builds institutional leadership, public support, and political will for climate solutions in the US. In addition to working with the health sector, EcoAmerica also has programs in the faith and local community sectors. As Paul just mentioned, climate change is a cross-sector, requires cross-sector collaboration, and so we're proud at EcoAmerica to work in these three sectors. It also reflects the partnerships that both Dr. Brenny and Dr. Satcher mentioned yesterday in the opening plenary. We tailor resources and support trusted leaders in each sector. When possible, we also find opportunities for that type of cross-sector collaboration. Climate for Health, as well as our other sectors, offer tools, resources, and communication to drive visible climate leadership, inspiring and empowering health leaders to speak about, act on, and advocate for climate solutions. I'm going to run through the suite of tools and resources that we offer to health professionals to empower their leadership on climate change. But first, take a look at this. These results this is from a Gallup poll in 2019 about the honesty and ethics of various health professions. This helps us know who people trust. And as you can see, some of the health professionals are in that top, or some of the most trusted and seen as the most ethical professions. So, this for us really tells us who the important messengers are and tells us that health professionals can be really important messengers on climate change. I should also note that there's a case to possibly be made about efficient transportation, but Eco America does not have any plans to roll out support for car salespeople in their climate advocacy. But we will continue to support health professionals in their work on climate. In addition to being highly trusted, health professionals are on the front lines of the climate and health emergency. They can see the impacts of climate change and health firsthand in their practices and among their constituencies. But actually the thing is, when you ask people, are they hearing from health professionals? Are you hearing from your doctor, about climate change? They're not. People are not hearing from health professionals enough on climate change. So now I'll run through the resources that Eco America and Climate for Health have in order to support health leaders in their climate advocacy. So a few years ago, we released the Let's Talk Health and Climate Guide. And by the way, all of these resources that I'll run through are available for free on our website, climateforhealth.org or at ecoamerica.org. So the Let's Talk Health and Climate Guide for health professionals includes tons of tips for messaging on climate and health. We include examples of successful messages, words that maybe we should start embracing more and words that we should maybe replace more. Some examples of key talking points and how to create your own message. We did a number of focus groups and surveys to build into this report. And we continue to build on the findings of that report to release a series of talking points on timely topics. What you see on the slide is a set of talking points that we updated last month to help health professionals talk about the importance of preserving the Clean Air Act in all climate solutions. It's a bit of a tricky subject, but some of the policies out there that propose a fee on carbon actually include a provision to roll back some of the protections in the Clean Air Act. The Clean Air Act's authority the Clean Air Act's granting of the EPA's authority to regulate carbon pollution. Advocates of these policies say that EPA's regulation of carbon emissions won't be needed if the mechanism they're advocating for is successful. But this argument really doesn't fly with health advocates, who really understand the success of the Clean Air Act in the 50 years it's been on the books. So we worked closely with our partners at the American Lung Association to build this communication tool to help health professionals explain how and why a carbon fee and dividend policy is complementary to the Clean Air Act regulations and why the Clean Air Act is a critical tool for public health. I was so grateful for Dr. Satcher's focus on mental health and the disparities in mental health treatment in his remarks yesterday, which were echoed in Lisa's comments introducing this panel. And now is a particularly important time to focus on mental health needs as we implement social distancing, which can take a toll on everyone, as Lisa alluded to. Mental health is also an important component of climate change. We're seeing this reported more frequently in the media, thanks to the youth movement. They're being really open about their frustration about inheriting this problem from generations who could have acted decades before. And they're also talking openly about how they feel overwhelmed about how big this issue is and how hard it's going to be to address it. People can experience mental health impacts like post-traumatic stress disorder after an extreme weather event. For example, if they lose their home, if they feel a sense of displacement, or if they lose a loved one. Our mental health and climate change report, written in partnership with the American Psychological Association, outlines the underlying concerns and then provides sets of recommendations for individuals, for communities, and for mental health practitioners. The Moving Forward Guide is our newest publication in the program. It's for health professionals in small offices, clinics, and health departments across the country who want to lead on climate but need support to act. It offers guidance on how to reduce energy consumption and use clean energy, how to prepare for climate impacts, and how to engage community and policymakers using clear, positive, inclusive, and relevant messages. And if you flip through the guide online, you'll see that we also use the BRACE framework and adapt it to some of the narrative that's in the guide. So it's definitely a useful tool from the CDC. The Moving Forward Guide includes a fierce call to action and tools for health professionals to demonstrate visible national leadership and mitigate their own footprint. We're also now pleased to offer the Climate for Health Ambassadors training. The training itself is 4 hours in person. So trust me, there's lots more to talk about on this issue beyond today's panel, and I hope many of you are engaging on the online Twitter chat as well. I'm looking forward to reading through your answers after the panel. We're also looking for online platforms for the training as well, as we know in-person meetings aren't always possible. In the training, we walk through climate and health impacts. You'll actually see some of the slides from that section a little bit later. The scope and scale of solutions, communications guidance, and also advocacy. With this training, health professionals will be able to engage their colleagues, associations, the public, and policymakers to inspire climate solutions that help protect the health of families and communities now and ensure a prosperous, just, and secure future. Our ambassadors, our ambassadors, the ones we've trained are now out, giving talks, taking actions, and what we hear back from them is everything from, they're giving TED-style talks, they're giving medical grand rounds, and submitting commentary to peer-reviewed journals. EcoAmerica also conducts an annual American Climate Metrics Survey, tracking American climate awareness, attitudes, and behaviors. We use this research to inform the tools and resources we have produced and the way we frame ongoing research moving forward. I'm just going to run through a couple of the results from 2019. So first of all, as Paul was alluding to, climate change is happening. 80%, almost 80%, a clear majority of respondents say climate change is happening, and 51% say the effects have already begun to happen. And then if you look as well, 66% say they're personally impacted. That's a mix of those who respond, they're impacted a lot, some, or a little. But it's interesting to look at the way that people respond to a series of questions about who it will impact. And you'll see, they definitely say climate change will impact future generations. It's definitely a problem. We just saw some people say it's happening now, but definitely there's a general agreement it's going to impact future generations. It'll also impact low-income households and African Americans, followed by Latinx populations. And lastly, they think, oh yeah, it may also affect me or my family. So there's still this gap between people thinking that it will affect them, and it'll definitely affect future generations. And so it's our job, to really personalize the impacts of climate change, because once people realize that this is impacting their health and their family's health, they're much more willing to act. This is from a deep dive on people's attitudes and beliefs on the health impacts of climate change that we published this time last year, in which we found 2 out of 3 Americans believe that if the US took steps to prevent climate change, it would improve our health. And in that same analysis, we also found that 88% of Americans believe that we have a moral responsibility to create a safe and healthy climate for ourselves and our children. The climate movement has an urgent opportunity to demonstrate and communicate about how clean energy and other climate solutions protect and enhance personal and public health. And we're thrilled to be working with many of our partners like the American Academy of Pediatrics, to talk about impacts that climate change is having now to us and to children especially. So the final statistic I'll share from our research is about people's concern for climate change. As you can see here, almost 3/4 of respondents say they are personally concerned about climate change. That's a 14-point increase in those who are very concerned since 2015. So like I said, as Paul was just saying, there's many more people moving into the camp of very concerned. However, and this is important, when you then ask them whether they think others around them are concerned, only 59% say others around them are somewhat or very concerned. So there's a 15-point gap in reality, in what reality versus perception. People are actually very concerned, but they don't think others around them are concerned. They feel alone in their concern. So again, it's our responsibility as health professionals to let them know they're not alone in their concern, that really majorities of Americans are concerned about climate and understand that we need to act and that actions will improve our health. Now that we've reviewed what people are thinking, I want to spend some time on the health impacts of climate change and reinforce much of what Paul said. So this is actually the introductory slide to our health impact section of our Climate for Health Ambassadors training. In the full training, we review several statistics and examples for each of these impacts. We rely on the sources already mentioned, like the National Climate Assessment and the Lancet Countdown, as well as CDC and NIEHS data for this information. Increasing frequency and severity of extreme events, hurricanes, heat waves, and wildfires puts people in direct harm and inhibits necessary healthcare delivery. I'll talk more about health disparities in a moment, but it's also important to just know that for each of these impacts, people are going to be affected differently. Different populations are going to be impacted differently. For example, in addition to the mental health impacts I mentioned earlier, like PTSD, another heat-related impact we need to consider is for those who are on medication treatment for a mental health condition. Some of these medications actually impact the way we're able to regulate our body temperatures. And so heat may actually have a greater impact on those folks, as well as on pregnant women and older adults. Longer term impacts of climate change can include flooding in houses that leads to mold and disrupted food delivery that exacerbates food deserts. Actions taken now to mitigate climate change and transition to clean energy will have a multitude of health benefits. One important note on this side. When you go out and talk to others, it's really important that you don't overwhelm them with information. It's different for us. You know, we came here today ready to learn. We're here ready to absorb all this information, excited about the topic. You know, but when you're talking to others about this, you really don't want to go through the laundry list like this. You know, you want to pick maybe one or two impacts, make it really local, personalize it, because if you try to give too much information, people, especially if it's new information, or especially if people are skeptical about this information in the first place, they will shut down. They will not hear you. And so you become a more effective messenger when you can meet people where they are, and choose a couple of things that are going to resonate with that person. So here's one example, and you know, Paul and I coordinated on a couple things. We didn't coordinate on allergens, so we're both talking about it. So I think you know, it goes to stress the importance of some of these impacts, and especially some of these impacts where we're having emerging, you know, more information emerge, more and more information available for us. So here's an example of a more in-depth slide on one climate impact to our health, this one on allergens, which I'm actually going to personalize because in addition to the statistics, which you can read on the slide, you know, storytelling is a really important component of talking about climate and health. So I live in Washington, D.C. I've actually lived in this general area my whole life. So, you know, when people move to DC, DC is a pretty transient city. So when people move here, bam, they're hit with allergies. They get, you know, I've heard over and over throughout my life, like, how do you do it? The allergy season is so bad here. And for me, again, having lived here my whole life, you know, I'm used to it. I'm not really affected by it. So here's the tissue, here's an allergy pill. You will get through this together. You'll be okay. But not anymore. Now, certain times a year, I'll hop on the bike or I'll be on my way to work and tears are just streaming down my face. I'm congested, you know, and I know, and it's because the allergy seasons are really getting longer and more severe. You know, ragweed is proliferating in the Northeast, and allergy seasons are longer and more severe. And I repeat longer and more severe because, you know, frequency and duration are really themes when it comes to climate change, that there are, of course, going to be existing conditions, but climate change is for a fact increasing the duration and severity, you know, the duration and frequency of many of these impacts, including, so when we talk about extreme weather, we talk about that as well. It's true for allergens as well. So being at the SOFI conference, I thought we should make sure we cover our basics and review what we learned as part of, you know, the MPH program, and shout out to University of Maryland where I got my MPH. But we want to talk, I find this infographic really helpful in talking to especially public health professionals about climate change and health. You know, it's important on this infographic to see, you know, first and foremost at the top, the driving force behind all of this is our increased emissions. And then those emissions force certain climate pressures, which then find their way through exposure pathways and resulting health outcomes. So again, if you're a public health professional, this is a really helpful infographic. And it's from the 2018 Lancet Countdown US Brief, which again is available online. APHA is a publishing partner on that. And so you can get it online. It's really helpful. So I just wanted to point this out as another way to visualize some of the impacts. And just to add a bit of current events here, one thing we're learning more about now is whether lung damage from fossil fuel pollution, because remember that fossil fuel pollution is not only a climate driver, but also has acute impacts for those who are exposed. That whether, lung damage from being exposed to fossil fuel pollution actually makes people more susceptible to COVID-19. It contributes to some of the underlying respiratory conditions. This infographic is straight from the 4th National Climate Assessment and does a nice job summarizing vulnerabilities to climate change. While climate change affects us all, low-income communities, communities of color, people with chronic disease or disability, children, and the elderly are some of the most at risk. This is not a new concept. Dr. Brenny, in her opening remarks, quoted Dr. King's statements about the most egregious forms of inequity showing up in our healthcare system. And since the 1980s, hard data coupled with stories of people's lived experiences have demonstrated disproportionate impacts of environmental hazards to low-income populations and communities of color. Climate change has this same impact, exacerbating existing disparities and creating new threats. As we seek climate solutions through mitigation and advocacy, we must incorporate health equity into our principles and planning. Through the social determinants of health framework, you all know that race and ethnicity, socioeconomic status, age, and education are among the factors that affect health outcomes. These factors also impact a person or a community's ability to respond to additional environmental exposures, including climate change. In this country, your zip code has a greater impact on your life expectancy than your genetic code. Many of you heard Dr. Kaplan highlight this earlier today in his talk, where he highlighted a 20-year difference in 2 zip codes, a 20-year difference in life expectancy in 2 zip codes in Philadelphia. And that's also true in a study that was done in my hometown of Baltimore. But when we go talk to others outside of the public health community, which includes many policymakers, they may never have heard of the social determinants of health. Sometimes what we take for granted as truth and underlying principles of our work in public health, other people may only understand as jargon. Climate solutions present an opportunity to build health equity into our policies and practices at all levels. Promoting equitable climate and clean energy solutions will create a more healthy and prosperous future for everyone. And we need those trusted health voices at the table, in the halls of Congress, and on the streets to help others understand climate change as a health issue. To add another connection to current events, if you take a look at the infographic at the bottom right corner, you'll see the folks rescuing people from a flood. And a lot of emergency responders are thinking about what to do in the face of an extreme weather event under social distancing recommendations. How do we rescue people safely, and where can they shelter safely? So if you can't tell by now, I like infographics. This infographic is pulled from the 2019 Lancet Countdown US Policy Brief. I know it's hard to read and digest now. There won't be a test, but I highly recommend that you download this report and take a look. This is a great summary of the different ways heat can impact people depending on their background, occupation, and/or life stage. It also highlights the ways different interventions, in many cases the adaptation measures that Paul talked about, can improve health outcomes. This graphic is based on the U.S. Global Change Research Program's regional findings in the 4th National Climate Assessment. And this is actually in the Moving Forward Guide. Again, I know it's hard to digest now, there's a lot here, but the take home is climate change will look and feel differently in different places, and this type of regional data is particularly important for preparedness efforts. So right about now, you might be wondering, well, what can I do about it? So first of all, we can each do our part to reduce our footprint. We can increase energy efficiency, one of the unsung heroes of climate solutions. We can take public or active transportation and switch to clean energy where possible. We can do this at home, and we can do this at work or in our houses of worship or with your professional association. And we can help others do the same. Last year, we recognized 4 organizations who signed the Climate for Health 100% Clean Energy Declaration: APHA, Physicians for Social Responsibility, the Alliance of Nurses for Healthy Environments, and the National Environmental Health Association. These are health leaders taking their climate actions to their members and to the public to emphasize the importance of health leadership on climate solutions. So this is the part of the presentation where I admit to something. I am a recovering lobbyist. So if you look closely in one of these photos, I'm part of the group delivering a prescription for a moratorium on fracking to Maryland elected leadership. So at the time, I was a registered lobbyist in the state of Maryland doing work for a small environmental health nonprofit. I was part of a coalition that was eventually successful in passing a legislative ban on fracking in the state of Maryland. As health data on the impacts of fracking increased, including harms from natural gas infrastructure across pipelines and compressor stations, which are all part of the process, it was important that health professionals get engaged on discussions with advocates and decision makers so we could be honest brokers of the information. Legislators were trusting and respectful of the health perspective when it came from actual health professionals who could answer questions. It was my job to be there every day. I built, a solid reputation, but it really, really made a difference. I always like to say, my currency was not the bourbons I was buying people after hours. It was the studies I was taking in the halls. So I was bringing in peer-reviewed literature. I was helping legislators sort through it. Understanding the source of that funding for that study and sort of helping them understand, which sources to trust. So I was trusted, but it made a much bigger difference when working health professionals, took time out of their daily jobs to come in, when we could have nurses, physicians, public health professionals come in and say, yeah, normally I'd be in the hospital saving lives, but today I'm here testifying on this piece of legislation because it saves lives. And that's so impactful. Your voice as health professionals matters in the advocacy arena. And if you work in a health department or other public service role within government, there's a lot you can do to contribute to advocacy before you even come close to lobbying. And you can do even more as a private citizen representing your own views. Get engaged with the state chapter affiliates of SOFI, APHA, NEHA, or other professional association and lend a hand to their advocacy efforts. The state affiliates rely on your expertise and enthusiasm. Personally, I'm a member of the Maryland Public Health Association outside of my professional life, and have pitched in during the Maryland legislative session to support a couple of letters on a pesticide ban and on 2 different pieces of climate legislation, one on heat standards for outdoor workers and one on a carbon fee and dividend. The infographic on the slide is adapted from the NACCHO Advocacy Toolkit. It has more information about the differences between lobbying, advocacy, and education, and many of our partners have similar guidance. The health community is uniting behind Climate Action for Health and Health Action for Climate. The U.S. Call to Action on Climate Health and Equity launched last summer with 70 organizational signatures and now has more than 150. The call to action includes a priority action agenda with 10 policy pillars that we can support as part of a healthy and equitable future. We're hosting a webinar with several partners on April 7th as part of National Public Health Week to hear from advocates across the country who are using the call to action to advocate for climate solutions. For example, the Oregon Public Health Association has adapted the call to action for their state-level initiatives and work to raise awareness about the health effects of climate change and ask the state to take immediate policy action. This slide illustrates just some of the many diverse organizations across professions who have signed the call to action. Climate advocacy really involves a spectrum of activities, appropriate for any level of advocate, whether you are seasoned or just getting started. The first step is preparatory. It starts with becoming climate and health literate. Get immersed in the issues, understand what you're talking about, know how to personalize it, like you're all here doing today. And then the rest, it's not linear. You can jump in where you feel comfortable. Move to the step where you feel comfortable. Write a letter to your local paper, call your legislator, or better yet, in a couple weeks, go visit in person. Ask your professional association to make a clean energy pledge. Here are some examples of published articles and letters to the editor, a global convening on climate change and mental health, and a picture of nurses with Jane Fonda during one of her Fire Drill Friday demonstrations in December. I mentioned youth advocacy way back in the beginning of my talk and wanted to bring it back here towards the end too. Student climate strikes have successfully impacted American awareness of the demands for climate action and are stoking adults' emotions, including hope, alarm, and motivation. New data indicate that over 4 million young people across America and 150 other countries are making their demands known in legal battles and coordinated strikes and are capturing the attention of the world in the process. Youth are giving us hope and a tangible agenda, and we need to support them. And finally, vote. Make sure you get to the polls. Help register others to vote. Volunteer at the polls to make sure that everybody has the opportunity to vote safely, and volunteer to help people get to the polls, people who can't get there on their own. Another timely and relevant step is participating in the census. Help others understand what the census is and what the information is used to determine. Everything from federal funding allocations to how many flu shots your local pharmacy gets. I would like to invite all of you to continue the conversation with us. We were originally planning to have the American Climate Leadership Summit next week in DC, but we've postponed to the end of August. The new dates are here. Registration is open at acls2020.org. And please keep in touch on social media. Here are our handles here. And you can subscribe to our newsletter at climateforhealth.org/subscribe. Thank you again so much. It's been a pleasure to be here, and I look forward to the discussion during Q&A.
Thank you, Rebecca. Really appreciate your comments. We're going to move into the Q&A section. I see that we have a number of questions in the Q&A box and a couple in the chat box, so we'll get to all of those. Paul has also answered a couple of questions that were in the Q&A box, so if you had put a question there, make sure you look under the answered tab as well. We'll start with a question for Paul. To what extent is the CDC collaborating with international agencies to collect data on climate change related health indicators?
Yeah, that's a good question. So we are mostly domestically focused, mainly because our funding from Congress is for a domestic program. So if you notice, all of the jurisdictions that we fund are in the U.S. And when I talked about CDC's National Environmental Public Health Tracking Portal, that's also domestic. But we do work internationally. So we've been partnering recently with Health Canada. They have a program now that's very similar to ours that just started funding provinces last year. And we've also worked on a number of other globally and more internationally focused projects. For example, GHIN, the Global Heat Health Information Network, which is a multi-country effort to help protect people from heat waves. As far as data specifically, our program doesn't collect any international data on climate health, but CDC certainly does. So for example, vector-borne disease data from around the world that CDC collects, those parts of CDC might not be collecting it for climate change purposes, but it certainly can help researchers who are looking at climate health. So the answer is, we haven't been doing international data collection, but there are other places within CDC and elsewhere that are collecting relevant data internationally.
Thanks, Paul. Another question for you. How much does your office work on climate mitigation as well as climate adaptation?
Yeah, so at CDC, we don't work on mitigation at all. So just in case not everyone's familiar with those two different terms, mitigation is actually trying to prevent climate change, so greenhouse gas reduction. So when you're seeing messages like, drive your car less or reduce your carbon footprint, that's talking about mitigation. What we work on is the adaptation side, which is saying we're already seeing these effects. We see they're getting worse. What do we do to adapt to prevent the health impacts from them? So we help to build that capacity so that health departments really have the capacity to do that and to adapt. We do work with other partners and federal organizations that do the mitigation side. So for example, Department of Energy, EPA, or other federal agencies who work more on that mitigation side. We also have interventions that health departments are putting in place that accomplish both tasks. So for example, if one of our grantees determines that a certain neighborhood is particularly vulnerable to extreme heat, they might have a program that plants trees. So just off the top of my head, the state of Vermont is doing that. And their main goal is to bring shade to neighborhoods to reduce their temperatures to help protect people during heat waves. But those trees also happen to be a carbon sink. So they work both for mitigation and adaptation. So even though we don't work specifically on mitigation, there certainly are things that health departments are doing that have co-benefits and work in both ways as an adaptive measure and as a mitigative measure.
Excellent. Thank you. Rebecca, a question for you. Does a health educator need to get an advanced degree in environmental health to work in this area?
That's a great question. Thanks. And I would say definitely not. You can absolutely work in this area without, I think it's critical that we actually have more people with a solid grounding in public health, not specifically environmental health, but in public health to be weighing in the climate space. I think in general, folks who are trained in public health broadly and in health education really have great communication skills and a great understanding of that social determinants of health framework that can really be useful in talking about the equity implications. And those are some of the really important points that aren't getting through to folks. I would check out some of the language in our Let's Talk guide, and then in our, and there's so many resources like that we have and like CDC has, and you can, do some reading and sort of, become become familiar on these issues by reading some of the reports that are out there. But definitely not. I think in general, what we need is more health professionals broadly weighing in on these issues and getting engaged on the at every level. So no, I definitely don't think you need an advanced degree in environmental health, but definitely more public health professionals weighing in on the issue and helping frame it for decision makers.
And more health educators, because we know health educators can do anything.
Agreed.
Another quick question for you, Rebecca. How is Climate for Health partnering with SOFI?
Great question. We are, I'm thrilled to be here and have been invited to be here. And through actually talking through the plans for this conference, we have begun some partnership discussion. So more to come on that. Hopefully is the first step in a broader collaboration.
Great. Paul, does the CDC work with programs like Meatless Mondays, and how can that improve health?
Yeah, so our program specifically doesn't. We're a pretty small program, but I know other parts of CDC definitely work on that. There are parts of CDC that encourage physical activity, safe routes to schools, healthy homes initiative, better nutrition. So there are parts of CDC that work on those different topics. I'm not sure specifically on Meatless Monday, but that's a good suggestion and something we certainly could try to loop into a little better.
Great. Question for either one of you. What is a succinct and pithy response to those who claim that climate change has happened throughout the millennia? I hear that often from others in my community, one of our attendees is saying.
Yeah, Paul, do you want to take that? You want me to go first?
Yeah, you can start on that one.
Great. So I think first of all, we need to meet people where they are in these conversations. I think we've mentioned, there are people who tend to be skeptical. And there are people, but for the most part, people understand that climate change is happening now. It's because of human activities, and the pace at which it's happening has never been seen before on a global scale, which is how we know that it's because of us, and it's because of our carbon emissions. And so one key piece of advice in our messaging guidance is stay above the fray. One thing that you just don't want to do is sort of go, you can have a productive conversation with someone without getting into the weeds if you feel like that person is not going to get on board and be on the same page as you. So definitely stay above the fray. Don't, keep the conversation friendly. Try to give local examples, personal examples of why folks are more vulnerable. First of all, it is happening. It's because of our climate emissions. It's because of our carbon emissions, and we know that because of the pace at which it's happening. It's impacting people now. So one thing you can do is, if you're not going to agree on the source, like if you find through your conversation that you're really not going to agree on the source, can you agree on solutions? Can we talk about ways to move forward because climate change is happening? And you know what? If you want to believe that it's not because of humans, and I'm not going to convince you about that, what I'd really like to do is work with you on solutions. Are there areas of common ground that we can find that have to do with protecting kids, creating cooling centers? So I would encourage you to, if you're very quickly not finding common ground on cause, try to move to common ground on solutions.
Excellent. Thank you. Another question for either one of you. Do either one of you want to offer any thoughts regarding the Green New Deal?
I'm not sure the CDC can take a position on it specific policy. So again, I'll take that one. And it's actually, so the Green New Deal is one of many climate solutions being proposed. And so what we try to do at Eco America and Climate for Health is, first of all, if we're talking about climate solutions, talk about the way climate change is impacting health. So, first and foremost, whatever policy you as a health professional decide to support, make sure that you're helping with some of the talking points and the framing around climate and health. We at Eco America and Climate for Health don't, as a rule of thumb, although we're exploring new advocacy options, as a rule of thumb, we don't take specific positions on specific policies, but what we try to do is help health professionals with framing, help health professionals understand how climate change is impacting our health and impacting now, and then how to talk about that with others. And then, it's one of the reasons we take that approach is because there's, the Green New Deal on the national level, but then so much of the work is local and so much of the climate solutions are going to be through local policy. And, the different energy infrastructures in different states are really different, whether they have a renewable portfolio standard or energy efficiency initiative. There's just a lot of different nuances on the state level. And so we want to give people the knowledge and understanding to be able to weigh in on those policies and then use their judgment, use the expertise of the folks really immersed in the advocacy arena, and especially on the local level, to give specific advice on specific policies. So the Green New Deal has a lot of elements in it that I think we could bring out and talk about how it positively would impact health. And there are some really interesting elements. One of the things I'll say about the Green New Deal is that it keeps equity, front and center. And that's just a key part of the conversation.
Excellent. Paul, are you able to comment on what NIH is doing in the area of climate and health?
Yeah, sure. So National Institutes of Health is another part of the agency that CDC is a part of, Health and Human Services, and we partner closely with them. So they actually are another co-chair of the group that I mentioned, the Federal Climate Change and Human Health Group. So that group is co-chaired by CDC, National Institutes of Health, as well as NOAA, the National Oceanographic and Atmospheric Administration. So that group, we meet monthly virtually, and then we have a number of products. We give input to the National Climate Assessment. So NIH has been very active in that group. They've done an in-depth literature review on climate health, and that's available on their website. So you can go, and they actually have a portal where you can search for different literature, peer-reviewed literature on climate and health. So they've really been active in this, and then also in collaborating with professional organizations and nonprofits that are more on the healthcare side. So CDC, we're not a healthcare agency, we're a public health agency, but NIH is way more into the healthcare side of things. So they've done some research, for example, on hospital preparedness for climate change. So they've been a really important partner and have done a lot of good work in this topic.
Excellent. Thank you. Rebecca, what policy priorities of Eco America have the best chance to pass in Congress right now?
Yeah, that's a good question. When it comes to specific policies in front of Congress, we tend to defer to the expertise of the organizations that have paid lobbyists and who have government relations staff. So like I mentioned, American Lung Association is one of them, American Thoracic Society. Some of these organizations and membership associations have dedicated policy staff who are on the Hill every day. In general, climate policies aren't having a very good chance at all in moving through Congress right now. But our job is to keep the drumbeat up, make sure we engage more health professionals so that when the time comes to pass this type of legislation, that the health education and public health workforce is ready to support it. So what we're using this time where not as many of the bills that we would support are passing is to really keep the momentum up, because the time will come when they will pass. And the time will come when the urgency is felt by all. And so we've really used this time to make sure that we're, through the ambassadors training, through the Moving Forward Guide, making sure that health professionals, health educators are ready, to step to the plate when the bills have a better chance of passing.
Great. As we get closer to the end of the session, I have one final question for each of our panelists. Paul, for you, can you talk about the importance of partnerships in this field and maybe highlight some of the cross-sector work that's going on?
Sure. Yeah. I mean, partnerships are absolutely critical on this topic. You know, as I mentioned, we're a very small program. We can't do it all on by ourselves, and there are a number of different groups that are doing just amazing work on climate and health. So we partner with government agencies across the board, so down from the local, state level, all the way up to other federal governments and international. We partner with nonprofit organizations as well as professional organizations. So, you know, groups like SOFI, and then we also have cooperative agreements with 7 of those nonprofits. So we actually provide funding out to 7 different nonprofit organizations, ranging from the American Public Health Association to the National Indian Health Board, because they can do work that we can't. They reach out to different audiences. They have a different membership, and really getting the messages across, creating products that reach out to specific groups. For example, the American Lung Association, we worked with them on 2 webinars last year to look at how climate change impacts respiratory health, one for the general public or people who have respiratory health conditions, and one for the healthcare industry and workers who work on topics such as asthma. So these partnerships have been absolutely critical. I'll also mention partnerships with tribes have been very important, as well as territories. So it's not something we can do on our own. None of us can. And it's actually been great to see a lot of the independent work that's being done by especially nonprofit organizations and universities on this topic.
Excellent. And our final question for you, Rebecca, how can we help people not feel overwhelmed by the enormity of this issue so that they really feel empowered to take action?
Yeah, thanks for that question. You know, I think we need to be able to give people tangible actions. You know, one of the things I showed was that sort of roadmap, was the stepwise roadmap that had a step-by-step approach to what we each can do. And sometimes this topic, you know, the term is eco-anxiety. People are just really freaked out. The news doesn't follow the framing advice that Paul and I gave today. You know, they tend to use a little bit of fatalism, and, you know, it's all images of fires raging and sad polar bears, you know, rather than talking about the opportunities that we have to really band together, even when we're social distancing, you know, band together, talk about these issues in a way that provides people tangible actions. You know, biking and walking to work, which biking, walking, and rolling to work, the American College of Sports Medicine makes sure to include rolling in their definition of active transportation to make sure we're inclusive. That we are, you know, facilitating those kinds of actions because they're not only good for the environment and help mitigate climate change, they're good for our health. They have co-benefits. And we need to start talking about these win-win scenarios and giving people hope, letting people know they're not alone in their concern. You know, that gap that I talked about, making sure they realize that their neighbors care just as much as they do, and we can act now. We can take actions now that will benefit their future.
Wonderful, thank you. And as I said, in the issue of mental health and mental wellness, you're really speaking my language here. It's something I want to talk about a lot this year with APHA. So thanks to both of our presenters. It's been an awesome session. Elaine?